Hi guys, welcome to our another lecture series on thorax anatomy. So today we are going to focus on the joints of the thoracic wall. And then we are going to talk about the superior aperture, the inferior aperture, and the suprapleural membrane. Okay, so we said this from ossology, this is your sternum, the most anterior, most posterior, that's your thoracic vertebrae from T1 to T12. This one is divided into three manubrium, board of the sternum xiphoid process. The lateral portion of your thoracic wall is made by 12 ribs. So most likely this is a typical rib, which is rib number 5. So our first joint is between the manubrium and the sternum. That is called the manubrial-sternal joint. The manubrial-sternal joint is a secondary cartilaginous joint, but that moves, so therefore it is a symphysis joint. Right. So the manubrial-sternal joint, it will form an ankle or a transverse ridge called a sternal ankle. And we said that this will be your articulating side for the second rib, and the sternal ridge, it marks the counting of ribs from rib number 2 going downward, since the first rib will be at the underlying surface of the clavicle, so therefore it cannot be palpated. The sternal ankle is just a plane that we can draw from anterior to posterior. And if we draw this plane, the plane is going to meet the intervertebral disc between T4 and T5. And this sternal angle plane, it is going to demarcate or divide the superior mediastinum from the inferior mediastinum, and also this one is going to mark the bifurcation of the trachea. It is also very important. Right. So that is your manubrial-sternal joint, secondary cartilaginous symphysis joint. This is the board of the sternum to articulate the xiphoid process via what you call the xiphi-sternal joint. The xiphi-sternal joint is anterior to T9, and this is a secondary cartilaginous joint, but that has no movement, therefore it's a synchrontosis joint. So the joints of the sternum, they are all secondary cartilaginous joints. Now, this becomes your rib, and your rib is going to attach to your sternum via what we call costal cartilages. Costal cartilages are going to form what we call a costosternal joint, which is a contrasternal joint, sorry. A contrasternal joint is a joint between the costal cartilage and the sternum. And you have to take note of this. Remember, what costal cartilage is attached to the sternum? Costal cartilage of rib number 1 to rib number 7, right? And these costal cartilages, they will form what we call a contrasternal joint, and the contrasternal joint of the first rib, it is cartilaginous with no movement at all. But the remaining 2 to 7, they are all synovial. They are all synovial joint. So contrasternal joints, they are synovial joints except the one for the first rib. Then there's a joint between your cartilage and your rib. So that is called a costochondrial joint. This one is chondrial sternal joint. This is costochondrial joint. So this joint right here, it is a secondary cartilaginous joint with no movement at all. So this one, it is similar to the joint that is here at the xiphi-sternal joint. So no movement here. Right. And then if we go posteriorly, we're going to have joints where the rib is going to articulate with the body of the sternum. From our osteology, if it is a typical rib, its head is going to have two articulating facets, a superior and inferior. Inferior is going to articulate with the corresponding vertebrae, as superior is going to articulate with the vertebrae above. It also has a tubercle, and this tubercle, it is an articulating site that will articulate with the transverse process. So you're going to have 1, 2, 3 joints. Take note of this. The joints between the body of the vertebrae and the rib are all synovial joints. The joint between the rib, the tubercle of the rib, and the transverse process is also synovial joint. So this is synovial joint, this is synovial joint again. And then between the body of your vertebrae, so this is a vertebra, this is a vertebra. Between them, we are going to have an intervertebral body. An intervertebral body is going to be made by fibrocartilage. If you remember very well, centrally it's going to be made by the nucleus pulposus, which is a remnant of the notochord, and then laterally it's going to be made of your fibrosis pulposus, right? Sorry, it's going to be made by your annulus fibrosis. Very sorry. So centrally we have the nucleus pulposus from the notochord, and then we have the annulus fibrosis, which is from the paraxial mesoderm, right? Embryologically. So this between this vertebra and this vertebra, what we have here, it is just your a secondary cartilaginous joint, but that is able to move, right? So it is sort of like a symphysis joint here. So now let's revise the joints that we have. Mandibulosternal joint, secondary cartilaginous joint. Xivisternal joint, secondary cartilaginous joint. Costochondral joint, secondary cartilaginous joint. The first chondrosternal joint, secondary cartilaginous joint. Then the joint between your vertebrae, vertebral column, secondary cartilaginous joint. The following are your synovial joint. The costosternal joint of the costal cartilage of rib number 2 to rib number 7, they are all synovial joint. And then the joint between the rib and the thorax and the transverse process is a synovial joint, and the joint between the rib and the bodies of the vertebrae, it's also a synovial joint. Synovial joint, and synovial joint. Right. So now let us talk about the superior and inferior thoracic apertures. So this is your thoracic wall, which is conical in shape, a small upper opening, a large lower opening. So this is termed as a superior aperture. This is termed as inferior aperture. So what is important is to take note of the boundaries of these apertures. So the superior thoracic aperture, it is made of the following boundaries. Posteriorly, we are going to have a T1 vertebrae. Anteriorly, we are going to have the upper border of the manubrium. Laterally, we are going to have the medial borders of the first rib. This superior aperture, it is going to transmit structures from the thorax going to the root of the neck. These are the following structures. You're going to have the trachea, you're going to have the esophagus, you're going to have some veins and arteries. Right. So inferiorly, this is your inferior thoracic aperture, which has the following boundaries. So what is the last thoracic vertebrae? Is a teeth cup. So teeth cup will form the posterior border of your inferior thoracic. Anteriorly, you're going to have deeper. Laterally, the margin So there are structures that are transmitted via this inferior thoracic aperture. So the inferior thoracic aperture is going to be covered by what you call the diaphragm. The superior thoracic aperture is going to be covered by what you call a suprapleural membrane. So the suprapleural membrane, it is sort of like triangular in shape. That will come from C7, and then it's going to extend laterally at the medial border of your first rib, right? And then medially it's going to uh, continuous with the investing fascia of the structures that are moving from the thorax getting into your neck. And then in the inferior thoracic aperture, you have the diaphragm. And remember, the diaphragm, it can be pierced, right? It is pierced by the inferior vena cava. It is pierced by the esophagus, and then it's going to be pierced by what you call the thoracic aorta, right? We're going to talk about the diaphragm very soon, right? So this is your diaphragm, right? So another important thing that you have to take note of is that the suprapleural membrane, it is a thickening of the endothoracic fascia. So you're going to discover that below the supra, it is called suprapleural because behind it we are going to have parietal pleural, right? Just like in behind the suprapleural membrane, and you're going to have the apex of the lungs that will be protruding into the neck of into the root of the neck here, right? Which is very important. Right, so that is everything about the joints, the superior and inferior aperture, and the suprapleural membrane. So thank you so much, guys. See you next time.